I think we need to focus a lot more on the root cause of this problem, and we're getting close to it. I think a number of the witnesses have said it's the low prices, it's the race to the bottom. I think you have to find out, well, what's causing that? Now, I haven't heard the word monopsony purchasing power yet, where you've got basically the federal government with their drug formulary pretty well driving most of these prices. I would ask the witnesses, can you think of a common consumer product that is always in persistent shortages? Can anybody think of one? There may be some, but the reason there aren't is you've got millions, billions of consumers, and the marketplace takes care of all these problems. It demands higher quality. It demands better levels of customer service. It demands the best price. But because we have the federal government getting involved in the healthcare marketplace, it screwed everything up. Third-party payer systems through insurance is another kind of monopsony type of purchasing power as well. So we need to focus on what can we do to bring consumers back into the process here. I'm a manufacturer. I supplied medical device industry for years. We actually were able to, and our customer allowed us to charge a higher price to stabilize their price over a number of years, but also to ensure supply. Mr. Coquille, that's basically your company's approach to this. You increase costs by having buffer stock, correct? So you're able to provide a service. You'd probably be considered a middleman. And because if your company makes any money off this, generally the members of this committee would be criticizing you for skimming off the top and driving up prices, but you actually provide a service. Isn't that correct?
Thank you, Senator. We're a manufacturer, but part of what we do in contracting with hospitals is bypass the middleman in the transaction. So we work directly with hospitals. We don't go through the GPO contracting process.
That's a marketplace solution, okay?
That's a marketplace solution.
Dr. Wazinska, because when we were talking about PBM reform here, which, by the way, I'm the only one of this committee that voted against what the committee is trying to do here, because I don't understand how it's going to fix any problem. One of the questions I asked staff was, if this is going to lower prices for consumers, why is Big Pharma in favor of the PBM reform that they're proposing? Again, we're talking about right now shortages caused by a race to the bottom, too low prices. I mean, isn't it true that PBMs are negotiating lower prices for the organizations they're representing, and it's just not transparent in terms of how those prices get benefit consumers, because it benefits them in lower insurance costs and that type of thing? You want to respond?
Yeah, so PBMs really play a role in the oral dose market, not generic sterile injectables. They don't deal with hospitals, and really their role here is because they are a major pharmacy. This is the vertical integration. That's the piece, really not the contracting, but the fact that they own mail order pharmacies and that they also have specialty pharmacies. And just like any other specialty, they're incentivized to bring the lowest cost. What they mark up and how this is this shows up to the payers is a difference.
They're putting downward pressure on drug prices, correct?
Yes, there's absolutely downward pressure. And just to your previous question and your previous point about sort of where things break down and why is it that the consumer suffers, I just would like to highlight this. There's a lot of players in the chain, and each one of them is incentivized very differently, and they don't internalize the harm that results to patients. And I will say it's including, if you think about the cost on hospitals from shortages, $360 million, that's $60,000 per hospital.
In a free market, there would not be these shortages, certainly not with generic drugs. It just wouldn't occur, but it's not a free market. Government has interfered and screwed it all up. One point I want to make, because I think this is an enormous national security threat, is the fact that we do not, by and large, produce precursor chemicals. We do not produce the active pharmaceutical ingredients. I'm not for general economic engineering, but in this case, I think we do need Buy American provisions. Now, again, as you said, we're going to have to pay higher prices, but one of the reasons you have these huge markups, from the middlemen, is when you have a shortage. So if you didn't have those shortages, you wouldn't have those instances where people are responding to the marketplace, driving costs up, 1,000 times. If you eliminated the root cause of the shortages, bring back more consumerism, get rid of the monopsony type of buying power, that'd be a solution. But we do need to address, and we haven't. We have this infrastructure bill. I don't think we spent a penny on trying to bring back the manufacture of precursor chemicals and API to America. That is an enormous national security threat, and we're just ignoring it. Anybody want to comment on that?
If I could speak to this briefly, I completely agree with you that we need to be thinking about sort of the geopolitical threats. Where we face a challenge is that the enormity of this problem. To onshore everything into the United States, I don't know, trillions of dollars. What we need is to be really strategic about what are the essential medicines and which ones are really vulnerable.
It would not be trillion. It wouldn't be trillions. Again, the marketplace would respond to it if we allowed the marketplace to do it. But we're not. We're trying to do this through government control, and again, just government screws things up.
The time of the
Thank you, Mr.
gentleman's
Chairman.
expired.